16 shocking health facts every senior should know. Did you know that walking speed can predict how long you'll live? Or that something as simple as hearing loss could raise your chances of getting dementia? These aren't just random facts, they're health game changers that could seriously affect how you age. From silent heart attacks to losing muscle every year, the truth is that some of the most dangerous conditions come with barely any warning. So here's the big question. How many of these shocking health facts have been hiding in plain sight your whole life? Let's uncover them all. 16. Dehydration is a silent killer. As people age, their ability to feel thirst naturally decreases. This is a major shift in how the body signals its most basic need. By the time an older adult realizes they're thirsty, they might already be well into dehydration. This happens because the body's internal sensors for hydration, especially those controlled by the hypothalamus, become less responsive with age. As a result, seniors often drink less water than they need, without even realizing it. What makes this worse is that the kidneys also lose efficiency over time. Their ability to conserve water declines, which means more fluid is lost through urine. When this happens consistently, the body becomes chronically dehydrated, and the symptoms aren't always obvious. Instead of feeling dry-mouthed or thirsty, older adults might feel dizzy, tired, or confused. In many cases, these signs are mistaken for normal aging or even early dementia, when they're signs of not drinking enough water. Even mild dehydration can cause serious problems. It thickens the blood, making the heart work harder and increasing the risk of clots. It also affects blood pressure regulation, leading to dizziness and a much higher chance of falls. Dehydration can also impact kidney function. Without enough water, the kidneys struggle to filter waste efficiently, which can lead to acute kidney injury or worsen chronic kidney disease. 15. One fall can double the risk of death. Every year, more than 1 in 4 adults over 65 experiences a fall, but what often starts as a simple slip can quickly become a serious health hazard. Falls are the leading cause of injury-related deaths among older adults, and the numbers are rising. According to the CDC, around 36 million falls are reported among older adults annually in the United States alone, resulting in over 32,000 deaths. The most dangerous outcome of a fall is a hip fracture. These injuries almost always require surgery, followed by lengthy hospital stays and rehabilitation. Around 95% of hip fractures are caused by falls, and the consequences are severe. Studies show that up to 30% of seniors who suffer a hip fracture die within a year, mainly due to complications like infections, immobility, or pre-existing health conditions that get worse during recovery. Even those who survive the injury often lose their independence. Nearly half of older adults with a hip fracture never regain the ability to live on their own again. Many are forced to move into long-term care facilities, not because of the injury itself, but because of the loss of mobility and increased dependence on others. 14. Heart attacks don't always hurt. In older adults, heart attacks often show up without the crushing chest pain many expect. Instead, the warning signs can be vague or easily mistaken for something less serious. Seniors are more likely to report feeling suddenly weak, lightheaded, short of breath, or unusually tired. Some even experience nausea or confusion. These symptoms are often brushed off as part of aging, a bad day, or even the flu, when in reality they could be the heart crying out for help. This is called a silent or atypical heart attack, and it's more common than many realize. Research from the National Institutes of Health show that around 1 in 5 heart attacks are silent, meaning the person either feels no pain or experiences symptoms that don't raise immediate concern. Older adults and those with diabetes are especially at risk for this type of presentation, largely because of nerve damage or changes in how pain is perceived with age. Shortness of breath is a particularly important red flag. It could mean the heart isn't pumping properly if it comes on suddenly, especially during light activity or even while resting. Other times the only symptom might be confusion or disorientation caused by reduced blood flow to the brain. These subtle signs are easy to overlook but can signal serious cardiac trouble. 13. Hearing loss is linked to dementia. Studies from Johns Hopkins University have shown that seniors with even mild hearing loss are twice as likely to develop dementia. The risk triples for those with moderate loss and is 5 times higher in those with severe hearing impairment. The connection comes down to how the brain works under strain. When someone struggles to hear, the brain has to work harder to fill in the gaps. It constantly tries to decode muffled words or missing sounds, especially in noisy environments. That effort uses mental resources normally used for memory, decision-making and thinking. Over time, this constant effort wears down the brain's ability to perform other tasks, leaving it more vulnerable to decline. Another part of the puzzle is physical. Brain imaging has revealed that untreated hearing loss is linked to faster shrinkage in parts of the brain responsible for memory and speech processing, such as the temporal lobe. The less stimulation these areas receive, the quicker they deteriorate. Hearing loss also tends to reduce social interaction, another well-known risk factor for cognitive problems. 12. Chronic inflammation speeds up aging. As people age, the body starts showing signs of persistent low-grade inflammation. This ongoing process is known as inflammaging, a term scientists use to describe the gradual rise in inflammatory markers seen in older adults, even in the absence of infection or illness. While it may sound harmless, this quiet, continuous inflammation plays a major role in nearly all age-related diseases. Inflammaging differs from the inflammation that happens when you catch a cold or sprain an ankle. That kind of inflammation is short-lived and part of the body's healing response. In contrast, inflammaging is subtle and long-term. It's driven by several factors, including aging immune cells that don't shut off properly, a build-up of cellular waste in tissues, and lifestyle habits like poor diet, lack of exercise and chronic stress. This low-level inflammation has been closely linked to heart disease, type 2 diabetes, arthritis, Alzheimer's, and even certain cancers. It contributes to plaque buildup in arteries, insulin resistance, joint deterioration, and gradual damage to brain cells. Researchers have found that higher levels of inflammatory markers such as CRP, C-reactive protein, and IL-6, interleukin-6, are reliable indicators of faster biological aging, regardless of someone's actual age. 11. Sleeping pills may harm your brain. Sleep problems are common among seniors, and many turn to prescription or over-the-counter sleep aids to get rest. But while these medications might help in the short term, using them regularly has been linked to memory decline and cognitive issues over time. Drugs like benzodiazepines, such as lorazepam and diazepam, and even some antihistamines found in common sleep products, can interfere with brain function when used continuously. Research from Harvard and the University of Washington has shown that long-term use of sleep medications may increase the risk of dementia. One study found that people who used benzodiazepines for 3 months or more had up to a 51% higher risk of developing Alzheimer's disease. These medications tend to suppress deep sleep, the most restorative part of the sleep cycle, essential for memory processing and brain repair. Another issue is that sleep aids often cause daily grogginess, leading to reduced alertness and increased fall risk. They may also interact poorly with other medications, especially in seniors taking multiple prescriptions. Over time, the brain can become dependent on the drug to signal sleep, making it harder to fall asleep naturally and worsening the problem that led to medication use in the first place. By the way, if you find these insights helpful, subscribe and turn on notifications so you never miss out on tips that can protect your health and well-being. Also, if any of these facts feel a little too close to home, please raise them on your next doctor's visit. 10. Gum disease is a heart risk. Many people think of brushing and flossing as ways to prevent bad breath or cavities, but oral health goes much deeper, especially in seniors. Gum disease, also known as periodontal disease, has been linked to a higher risk of heart attacks and strokes. The connection isn't just observational, it's backed up by years of clinical research. When gums are inflamed and infected, harmful bacteria can enter the bloodstream through tiny openings in the gum tissue. Once in the blood, these bacteria trigger inflammation throughout the body, including inside blood vessels. This inflammation contributes to the buildup of plaque in arteries, which increases the risk of blocked blood flow and clot formation. The American Heart Association has recognized this link, and studies suggest that people with severe gum disease are nearly twice as likely to suffer from cardiovascular issues. Another factor is that chronic oral infections place long-term stress on the immune system. Over time, this can weaken the body's ability to fight off other health threats, including those affecting the heart and brain. In seniors, especially those with other risk factors like diabetes or high blood pressure, neglecting oral hygiene can compound problems that already present. 9. Low vitamin B12 mimics dementia. Vitamin B12 plays a critical role in keeping the brain and nervous system functioning properly. When levels drop too low, the effects can look alarmingly similar to dementia. Symptoms like memory loss, confusion, trouble concentrating, and mood changes are all common in B12 deficiency. This is why it's often misdiagnosed, especially in older adults, as early-stage Alzheimer's or other cognitive disorders. The problem is that as people age, their ability to absorb B12 naturally decreases. This is partly due to lower stomach acid production, which is needed to release B12 from food. Conditions like atrophic gastritis, common in older adults, or the use of medications like proton pump inhibitors can make this worse. Some seniors may also follow low meat or vegetarian diets without proper supplementation. What makes B12 deficiency especially concerning is how treatable it is if caught early. Supplementing with B12, either through pills or injections, can completely reverse symptoms in many cases. But if the deficiency goes undetected for too long, nerve damage can become permanent. 8. Silent reflux can lead to cancer. Acid reflux doesn't always cause the classic burning sensation known as heartburn. In older adults, reflux can often happen without noticeable symptoms, a condition known as silent reflux or laryngopharyngeal reflux. This makes it particularly dangerous because damage can build up over time without any clear warning signs. Instead of heartburn, silent reflux may show up as a chronic cough, hoarseness, sore throat, or the feeling of something stuck in the throat. These symptoms are frequently overlooked or misattributed to aging, allergies, or the common cold, but even without pain, the stomach acid still rises into the esophagus and throat, irritating the lining and causing long-term harm. Over time, repeated exposure to acid can lead to changes in the esophageal tissue, a condition called Barrett's esophagus. This is a known risk factor for esophageal cancer. According to the American Cancer Society, the rate of esophageal cancer increases significantly with age, and many cases are linked to untreated or unrecognized reflux. 7. Infections can trigger delirium. In seniors, common infections like urinary tract infections or pneumonia can cause more than physical symptoms. They can lead to sudden mental and behavioral changes. Instead of fever or pain, the first noticeable sign might be confusion, disorientation, or even aggression. This condition is known as delirium, and it can appear quickly, sometimes within hours of the infection starting. The reason behind this reaction lies in how aging bodies respond to stress. As people get older, the immune system becomes less efficient and the brain becomes more sensitive to inflammation. When an infection develops, the body produces inflammatory chemicals to fight it. In younger people, this might cause tiredness or fever. In seniors, those same chemicals can disrupt normal brain function, triggering hallucinations, mood swings, or severe memory lapses. UTIs are one of the most common culprits. In fact, they're a leading cause of delirium in seniors, especially in women. Pneumonia is another frequent trigger, particularly in those who already have other health conditions. Sometimes these infections don't even cause noticeable pain, making the confusion seem like it came out of nowhere. 6. Medication overload sends seniors to hospitals. Many seniors take several medications every day, often for multiple health conditions. While this may seem routine, it can create serious risks when drugs begin to interact in unexpected ways. This issue, known as polypharmacy, refers to the use of 5 or more medications at once, and it's more common than ever among seniors. According to the CDC, nearly 40% of older adults take 5 or more prescription drugs regularly. As the number of medications increases, so does the chance of side effects, drug interactions, and accidental misuse. Some combinations can cause blood pressure to drop suddenly, raise the risk of bleeding, or affect kidney function. Others may amplify sedation, leading to drowsiness, dizziness, or confusion. These effects often result in emergency room visits, particularly due to falls, fainting, or severe reactions. What makes this more difficult is that many seniors also take over-the-counter medications, herbal supplements or vitamins, each of which can also interact with prescription drugs. Some medications that were safe years ago may no longer be appropriate as the body changes with age, especially with slower metabolism and kidney clearance. 5. Walking speed is a powerful predictor of life expectancy. How quickly someone walks in their senior years can tell a lot about their overall health. Studies have shown that walking speed is strongly linked to life expectancy. In fact, research published in JAMA found that seniors who walk more slowly have a significantly higher risk of dying within the next 5 to 10 years compared to those who maintain a faster pace. Gait speed reflects how well multiple body systems are working together: muscles, heart, lungs, nerves, and even the brain. When walking slows down, it's often a sign that one or more of those systems is under stress or declining. This doesn't just mean a little stiffness or tiredness. A consistently slower gait may indicate higher risk for heart disease, frailty, or cognitive decline. Health professionals often use a basic walking test, usually measuring how long it takes to walk 4 meters, to assess risk. Seniors who walk at a speed slower than 0.6 meters per second are often considered at higher risk for complications or even mortality. Those who maintain or exceed 1 meter per second tend to live longer, more independent lives. 4. Sudden weight loss is a red flag. Losing weight without trying might seem like a good thing, but in seniors it can be an early warning sign of serious health problems. When someone over 60 drops more than 5% of their body weight in 6 to 12 months without changing their diet or activity level, it should be investigated. This kind of weight loss often points to an underlying medical issue. One of the most common concerns is cancer. Many types, including pancreatic, stomach, lung, and colorectal cancer, can cause rapid weight loss before any other clear symptoms appear. The body begins burning more calories as it fights the disease, and appetite can quietly decrease due to changes in metabolism or unnoticed discomforts during meals. Depression is another major cause, especially when it goes unrecognized. Older adults with depression often lose interest in eating or forget to eat regularly. A flat mood, loss of routine, or isolation can all lead to unintentional weight loss even without other emotional signs. 3. Older skin absorbs less vitamin D. As people age, their skin becomes less efficient at producing vitamin D from sunlight. This is due to a natural decline in a compound called 7-dehydrocholesterol, which the skin needs to begin the process of converting UVB rays into usable vitamin D. By the time someone reaches their 70s, their skin may only produce about 25% of the vitamin D it did in their 20s under the same sunlight exposure. Vitamin D is essential for maintaining bone health, immune function, and muscle strength. Deficiency in older adults is common and has been linked to an increased risk of fractures, infections, and fatigue. Some studies also suggest it may play a role in cognitive function and mood regulation. Despite this, many seniors assume that being outdoors occasionally is enough, without realizing their skin's lower production rate. Because symptoms of low vitamin D are often vague, like general aches, tiredness, or frequent colds, it can go undetected for years. That's why routine blood tests are recommended, especially for adults over 65. A simple 25-hydroxy vitamin D test can show whether levels are adequate. 2. Loneliness can be deadlier than smoking. Loneliness isn't just an emotional experience, it's a serious health risk, especially for seniors. Research has shown that chronic social isolation can raise the risk of premature death by as much as 26%. That level of risk is similar to smoking up to 15 cigarettes a day, according to a study published by the National Academy of Sciences. When seniors lack meaningful social interaction, the effects appear in the body. One of the most concerning is how loneliness increases inflammation, which is linked to a range of chronic diseases, including heart conditions. Studies have shown that older adults who are socially isolated are more likely to suffer from high blood pressure, elevated stress hormones, and weakened immune systems. All of these factors contribute to a higher risk of stroke, heart attack, and overall cardiovascular decline. Loneliness also has a direct connection to mental health. It's strongly associated with depression, and not just in people with a history of mood disorders. Even those who were once socially active can feel withdrawn or hopeless if regular interaction disappears. Over time, this emotional decline can lead to reduced motivation to exercise, eat well, or keep up with medications, further harming overall health. 1. You lose muscle every year after 50. Starting around age 50, the body naturally begins to lose muscle mass, a process called sarcopenia. On average, people lose about 1% of their muscle per year after that age. This might not sound like much at first, but over a decade or two, the decline adds up. Less muscle means lower strength, lower metabolism, reduced balance, and a greater risk of falls or injuries. This loss happens even to those who are otherwise healthy. It's not caused by a disease, but by reduced physical activity and changes in hormone levels, especially testosterone and growth hormone. As muscle shrinks, so does endurance and the ability to do everyday tasks, like getting out of a chair, carrying groceries, or climbing stairs. The best way to slow this process is through regular strength training. Lifting weights, using resistance bands, or even doing bodyweight exercises like squats and wall push-ups can help preserve and rebuild muscle. Staying active with walking, swimming, or cycling supports overall mobility, but resistance-based exercises specifically target muscle maintenance. So, which of these surprising health facts caught you off guard? Share your thoughts in the comments, and don't forget to give this video a thumbs up and subscribe for more helpful insights. And before you go, check out this next video we picked just for you. Good luck and good health.